switch off my video so that people are not getting disturbed. So just let me know if you can see my screen.
Yes.
Okay.
But make it full screen. That's all.
Yeah, sure. I'll do one thing. Can you see my screen now?
Yes.
All right.
Yes. Yes.
Okay, so as I said, like there are two modules here. Today I'm taking module 1, which is nothing but sampling and sample size calculations. And module 2 is basic statistics and choice of test. What kind of test you have to apply for what kind of variables and things like that. So today's session is basically 45 minutes, but what I'm going to do is that I'll just cover briefly all the concept of sample size maybe within 30 minutes, and then like I'll let you to work on some of the examples, and probably you can just work yours. I mean, you can take it as kind of the work which you can do yourself, and let me know like if you are facing any problems. And uh, and uh, so uh, the kind of slides I prepared here, which are like driven by the research questions, which are probably already provided you, right, ma'am? Already, it's already provided to them.
Yes. Yes. We have discussed
Okay.
that.
Yeah, sure. So yeah, so those are the I have chosen those four research questions, and I actually framed my slides and also framed few exercises in this module 1, and the same thing goes with module 2 also. Okay, with that introduction, I am going to the content slide. um, so the philosophy here is that can you see my screen again?
Yes. Yes. We can see.
Okay. Yeah, so the philosophy here, just remember that sample size philosophy is that the only one question, like two questions rather. Okay, how many patients do I need? The first question. And how do I pick them? Okay, so if you are able to answer this question, and then probably you understand this concept very well. How many patients do I need, and how to pick those patients so that you have a expected answer from your data analysis and things like that. So that is the fundamental philosophy behind sampling and sample size. How many, I mean, just remember this always. When somebody asks you what is sample size, the objective of sample size is how many patients do I need for my experiment or clinical trial or any other the study you are doing, and how do I pick them? What is that mechanism I should use to pick them? So those are the two fundamental philosophies behind sampling and sample size. Okay. So now think this as something like say if you want to get the blood test done. Okay. Um, just think about it like you don't drain all the blood from your body, right? You're basically taking a small well chosen sample which tells you the story. Okay, so nobody is drained blood from your body. It's just that you're taking some sample so that that sample can be used to understand your body profile and things like that. As simple as that one. Okay, so why we are choosing a kind of why do we need to have a sample size? Why can't we? The question will be like, why can't we study everybody on this planet? Okay, imagine that there are say 1 million patients type 2 diabetes. Let's imagine hypothetical figure. Let's imagine. So the question will be like, why can't we study every one of them, right? So why do we need to have a sample? Okay, so there are basically three reasons here which I've kind of highlighted here to answer why part. One is in terms of time and cost. So basically, as I told you, like I'm putting the research question as a context here. Okay, so studying all type 2 diabetes mellitus patients in South India is impossible because there are so many millions of patients, right? A sample will give us valid answer at a fraction of the cost. So cost, time, and cost play a major role there. Okay, and the second reason for this is that precision. Okay, If you are able to choose a very good sample, say for example 2000 patients out of 10,000, let's imagine, it's all hypothetical figure here. So imagine that there are 10,000 patients having type 2 diabetes, but you are choosing uh, 200 patients which satisfy all the the conditions, and everything, like so a well-chosen sample of 200 patients will give a result almost as precise as studying 10,000 patients if it is done correctly. So this is very important that you have to underline this, if done correctly. Now, what do you mean by if done correctly? So that's something I'm going to, you can see the slides in the next coming slides. What do you mean by if done correctly? But basic thing is that if you are able to choose small set of patients, okay, which are kind of representative of your 10,000 patients, okay, so you need to understand like this, you have a bigger group of patients, and from that bigger group, if you are able to choose a representative sample of 200 patients or 200 subject, then it has the ability, that 200 patients data has the ability, uh, that it will be almost as precise as studying 10,000 subjects. You just understand this way, like you have a bigger pool, and then from bigger pool, you are choosing a smaller number of patients. That is the kind of, philosophy here. That's the reason I put precision here. So precision is very important. If the sample is taken appropriately, it will be able to generalize your results from 200 subject to 10,000 subjects. Okay, that is precision. And then sample size calculation, of the sampling from a bigger patient population, is a ethical obligation also. It's very important. If you consider clinical trial, for example, there is a case study which is provided to you, intra ethical, there's a comparison, dexmedetomidine versus fentanyl. So exposing more number of patients than necessary is unethical. Okay, that you can imagine, right? You are in your medical profession. You can imagine, like, exposing too many of patients to a particular drug is always unethical. So this is very important here. So these three reasons are there as a justification to have a sample to be chosen from a bigger population. So what are the three reasons? One is time and cost, okay, and the second is precision, and then ethics. Okay, so these 3 points will tell you why we need to have a sample taken from a bigger population. Now, how do we select? Okay, how do we select a sample from a bigger pool, right? uh, as I said, like, I told you in the previous slide, that if done correctly, right? Now, what do you mean by if done correctly? Is that in some way this slide will tell you what is that, the reason behind if done correctly. So basically, what we need to do is that whenever you are proposing, whenever you're putting the proposal for your, the, the the exercise you are doing, you need to remember these 5 terms here. Probably I would suggest that you put this information in your proposal, or the synopsis, or wherever it is, so that your guide is kind of convinced that you are taking your sample appropriately. So first one is target population. You have to define your target population. Okay, what do you mean by target population? Target population is nothing but all adult T2DM patients in South India with HbA1c greater than 7.0. So basically, if you go back to your research questions, you see all these things. Basically, from that research question, you have to define target population. So what is target population again? Target population is all adult T2DM patients in South India with HbA1c greater than 7.0. I'm hoping that all of you have seen those research questions, and I'm assuming that you have seen that. That's the reason I'm just uh, simply reading it. If you are able to correlate, I think that would be great. If you're not able to, if you didn't get a chance to see those research question, please keep it in front of you. What is that first research question on T2DM? So that you can map out, like, you can connect the dots now, like what I'm talking here and what is there in the research question. Okay, so target population again, all adult T2M patients in South India which HbA1c greater than 7.0. So third column will tell you there are millions, actually, impossible study. Okay, which is impossible study because there's millions of patients. Again, cost and time comes into picture here. Okay, Now, next thing is that study population. So what do you mean by study population? Number of T2DM patients attending your hospital's diabetic clinic, right? Let's imagine that, study population is nothing but type 2 diabetes patients attending your hospital's diabetic clinic. Now, the question is that, can you take that as a sample? Yes, more manageable, but still large. Because, again, out of millions, you may have like 10,000, I don't know, like in a particular time frame. So manageable but still large. Okay. And the next thing comes is sampling frame. So how do you define your sampling frame? The sampling frame is nothing but the list you actually draw patients from. Okay. So from where you are going to draw the patients, do you have any list? Do you have any register? Okay. So that will be a kind of appropriate way of selecting sample from your the entire population. Okay. So typically, all your OPT registers are like, if I understand correctly, based on my medical background, they are kind of very complete and up to date. So you can use that as a kind of source of information for creating sampling frame, right? And the next fourth point is you're actually drawing a sample from that sampling frame. Okay. So you select some 200 patients, you actually enroll and test for ACR and HbA1c. So that is nothing but your actual study participants. Okay. So we have seen target population, study population, sampling frame, sample, and the last one is generalizability. So you select your 200 sample patients in such a way that your sample analysis results should be able to extrapolate to the entire target population, which is like first point. Okay, if chosen correctly. So here the key point is that defining your sampling frame, and choosing appropriate sample. So these 2 points are quite important here. So when you're writing your proposal, please ensure that you define it very well in your proposal, or if it is like warranted in doing this exercise in your synopsis also, I think please do it. It's very important, so that when there is a viva, I mean, you should be able to, you should be comfortable to talk about how are you going to select your sample. Okay. So these are the like important framework here, which I wanted to talk about. So the next thing is like, now what types of sampling? Now in the previous slide, if you see again, I'll go back to previous slide now. Uh, Two things I told you, right? The third and fourth one, and defining sampling frame, and the fourth one is sample. These are the key things I told you. Okay. The next slide will talk about like how do you actually select the sample from that register. Okay. So basically in statistics, there are three ways of selecting. If you see the left side of the slide, there are two columns here in the slide. One is probability sampling and non-probability sampling. Okay. So I'm kind of talking about probability sampling now. Like how do you select a sample scientifically? Okay. There are basically three ways. One is simple random sample, stratified random sampling, and systematic sampling. Okay. Now, what do you mean by simple random sampling? Now, imagine that sampling frame which I told you. Imagine that every patient has equal chance. You use random number table or computer, basically the kind of technology you can use that. So simple example here is that draw 200 from OPT register randomly. Just randomly select 200 from OPT, right? So so that is one way of doing it. Okay. And then we have another sampling method called stratified random sampling. That is nothing but divide into strata. Okay. Like for example, do we have controlled HbA1c, uncontrolled HbA1c? Do you want to see that as a factor in your sampling? Then randomly select sample for each category. So basically it's nothing but divide into two strata. I mean, if you look at the research questions, first research question, controlled HbA1c, uncontrolled HbA1c. Just create those two, the strata, and then apply simple random sample for controlled, apply simple random sample for controlled. So don't worry too much about the technicalities here, but I'm just telling you the how part of sampling here. Now, as an example, I have given there, select 100 subjects from controlled strata and select 100 from uncontrolled T2DM. So that will make you 200 total. Okay. Now there are, just go back to the simple random. So in simple random, you are simply selecting 200 irrespective of whether they are controlled or not. Okay. But in this case, stratified random, you are selecting 100 from controlled and 100 from uncontrolled T2DM patients from the register which I was talking about. Okay. Now, third sampling method is systematic sampling, which is also quite scientific. Like you are basically selecting, say, every fifth diabetic OPD patient, every sixth diabetic OPD patient, and things like that. So that's up to you. Like whatever the number you want to use, fifth or sixth or seventh or whatever, you can choose that one. Okay. But out of all these three, when it comes to clinical trial, we are choosing the middle one, that is stratified random, which is like more scientific, which like account for the stratification factor, and there are high chances that it will you should be able to extrapolate your sample results to the entire population results. So that's why in a clinical trial, this is again a disclaimer here, probably you may not do clinical trial, because your case studies are mostly a kind of sort of observational kind of study. I don't think you need to apply any clinical trial concept here. But if you want to use clinical trial, then the middle one is more scientific, which in actual drug trial or the big pharma companies, we go for stratified random sampling. Okay, so those are the three scientific techniques of choosing sample. Now come to the non-probability sampling, which is like probably I would say more relevant to your cases, because your sample could be based on feasibility. Sometimes you just choose sample based on your feasibility. Okay, now there are three methods here: convenience, purposive, and consecutive. Okay, what is convenience? Just check, choose first 200 patient willing to participate. Okay, simple, very simple. Purposive, only patients with UACR greater than 300 mg. I mean, if you can go back to your research question there, you can have that criteria there. Okay, and consecutive, all eligible patients over a set time. For example, all type 2 patients between Jan to December 2024 or Jan to December 2025. Okay, so you can choose any of these things. So I basically put these slides from randomized clinical trial perspective, but it doesn't mean that in your experiment, academic experiment, I'm not saying that you need to go to randomized clinical trial, but you can use the concept of randomized clinical trial here, and you can choose non-probability sampling also, if you feel that after you discuss with your guide, which way you have to go ahead with that. Okay, so this is the kind of the thing which will answer your the first few slides, where I said, like, if sample is chosen uh, properly. Okay, so you can choose whatever the methodologies which is like suitable to you, but when you are planning to do a clinical trial, it should be really really scientific. Okay, so that's the reason I said stratified random sampling is more appropriate in clinical trial. Okay, all right, so let's come to the research question one. Again, I said, like, I'm stressing on the research question. Now our research question is diabetic nephropathy prevalence. So I put together some kind of high level, some sort of pointers to you, how you can choose your population, how you can choose your sampling frame and things like that. You need not follow this, but it's just that I put it. So first is define your population. What is your population here? So your population is that adult type 2 diabetic patients who are like greater than or equal to 18 years, attending diabetology, OPD, government medical college. So I just put it like, how do you define your population? And then second aspect is creating sampling frame.
Dr.
Now,
Shashi, just
yeah,
hold on. I hope all of you relate this question to the first session when we discussed 4 research questions, and I have shared the slides also. The first research question is, what is the prevalence of diabetic neuropathy in uncontrolled diabetes versus controlled diabetes, where controlled diabetes was less than HbA1c 7 and uncontrolled was HbA1c more than 7 in South India. That was the question he is referring to. Sorry, please go ahead.
yeah. So yeah, exactly, ma'am. So thanks for that. Just that's what I was telling. Like, if you are able to connect the dots, like, all these slides are driven by those research questions actually. But probably I would have done it more into a kind of clinical trial kind of setting. But again, having said that, you can choose your own methods there. So there is no hard and fast rule, depending on your experiment. So I defined the population. Next is I'm going to define sampling frame. I would say that OPT register Jan 2024 to December 2024. Total registered is something like 1,200 patients. Apply some, inclusion or exclusion criteria and whatever that applicable to you, and that create that sampling frame. And the third element is choose a method. Which method of sampling you want to choose, which is very important here. Like, scientific way of choosing the subjects. I said stratified random sampling, but again, it's up to you, like what way scientifically you can choose what methodology. Again, you need to have a good discussion with your guide on that. How do we select? You can propose your way, right? Definitely you can propose, and that's how you should do it. Actually, you as a nobody told us to do when we were a student, but I would suggest that you go ahead with your plan to guide. Your guide will be very happy, I'll tell you. Okay, that I sir, I have chosen this way to select sample size. Okay, are you okay with that? That could be a very good start to have a discussion with your guide. And then obviously, like, guide will give you the input, like, no, it cannot be the way, can you do this way? That's how the discussion should happen. So you choose a method, appropriate method, either probabilistic sampling that I told you, like simple random, or that conventional sampling, like, you select some some subjects from non in a non probabilistic way. Okay, and then if you are doing a clinical trial kind of settings, then we have to use a kind of computer generated random numbers things, which I don't want to touch base here, because I'm sure, like, most of you may not do that way. You want to do it more conventional or the feasibility way, selecting the samples. But ensure that you select sample quite scientific way, I would say. Don't just pick some subjects, but have good amount of discussion, good amount of brainstorming yourself on how do I select samples, so that I can have a better results and extrapolated results, right? So this is how you can relate yourself. And I would suggest that you do this way in your proposal. Okay, now question is that why getting right matters, like sample size. Why do we have a right sample size? What are the repercussions when you have too small sample size or too large samples? Again, this is something you need to remember in your experiment also. Like, although you may not do a random clinical trial, but you may want to ensure that your sample is not too small, or your sample is not too large. Okay, now too small, why? Because you may miss real difference which you are expecting to uh, which you are expected to see, or you are expecting to see in future. Okay, if your analysis will not, if your analysis says that if there is no difference, even though you're expecting some difference, then it's a problem. So that's the reason too small sample is not recommended. And your study shows no difference in nephropathy between controlled and uncontrolled. If that shows like that, whereas you believe that there is still a difference, then it's a problem. Okay, so waste of patients' time and blood samples. So that's a repercussion of that. So what happens if it is too large? Okay, too large will detect trivially small difference as significant. I don't want to, like, you expecting that the difference between two groups are really significant. If your sample shows a small difference as a significant, then it's a problem. It is not a scientific way of establishing significance. Okay, so again, waste of resources, too many subjects, then waste of resources and ethics board goodwill, that you will suffer there. And maybe unethical to expose more patients than needed, which we have already seen. So now the truth is in between, somewhere in between. Okay, you have to choose a sample in such a way that it is a representative kind of your entire population. Okay, and don't worry about the numbers I have provided here. I put something like type 2 error. Don't worry about that. I'll tell you what exactly is the number you have to choose there if you're running a clinical trial. Okay, now finally, in summary, the four things that that will determine your sample size if you are running a clinical trial. Okay, what are those four things? One is there is a number called alpha, there is a number called beta, there is a number called effect size, and there is a number called variability. Okay, again, I don't get into a rabbit hole. Don't scratch your head about what is alpha, what is beta, and but I'll tell you the simple explanation of that, or simple value. Okay. Now the alpha is actually is nothing but it is called as false positive. And I put it in the bracket, false positive. Okay. The number assigned for alpha is 5%. Okay. What is false positive? Look at that two small box in the upper left corner. Okay, it says missing the real difference. Okay, if you are not able to detect the difference between two groups, then it is, sorry, not that one. If basically what you're proving here is that you are saying that there is no difference between two groups. Okay, but actually there is a difference. Okay, if you are proving that there is no difference between two groups, but actually in reality there is a difference. Okay, that means it is alpha. So which you don't want to see. The number for that alpha is 0.05 or 5%. And next comes beta. Now it is relevant, like what I told you, like two small box, if you see, missing the real difference. Okay, so that number is like 80%, not 80%, sorry, 20% or 0.20. Okay, and then effect size. What is the difference you're expecting from the experiment you are doing? What is the difference? Okay, so that you have to assume at the beginning, so that it is a kind of input for sample size calculation. Okay, and then variability estimate, which is like coming from literature, like very important kind of entity for or the input or the component for your sample size calculation in actual clinical trial. Okay, now variability is nothing but your what is that standard deviation kind of thing you're expecting. Okay, so again, I'm not getting into the details here, but remember that these four components are important for your calculation of sample size in a clinical trial setting. One is alpha. What is alpha? Which is nothing but a false positive kind of thing, which is nothing but the in layman's language you can say alpha is nothing but if your experiment proves, remember these words, if your experiment proves that there is no difference. Okay, but actually in reality there is a difference, then you are committing a type 1 error or a alpha kind of situation. Beta, what is beta? Beta is nothing but you are missing the real difference. You are not able to prove that there is a difference between two groups, that is controlled and uncontrolled. Okay, that error is called beta, usually set as 20%, 0.20. And then effect size. What is that difference between those two groups, controlled and uncontrolled, you are expecting to detect from your experiment? Okay, the source for that is literature, the previous historical literature or any other pilot study done in the past and things like that. And then variability estimate, which is like in the form of standard deviation, which I will touch base in the next session. Variability is like something like everybody is like variable, right? And we are living in a world where everything is variable. Okay, you are going to your college is variable. One day you may go to college at 10 o'clock in the morning. One day you may go to college at 9:55. Some other day you may go to college at 10:15. The kind of difference you see every day when you are going to college, that is nothing but variable. So that component is very important for calculating sample size. Okay, now these are the science behind the kind of sample size when you're running a clinical trial. But as I said, like, not mandatory when you are doing a observational study, but ensure that you're as scientific as possible even when you are doing a conventional or observational study. All right, this I will what I will do is that I this is a kind of sample size formula here I have kind of provided to you. Basically this is in a clinical trial settings, but what I want you to do is that I'll explain you the things here, the components here. Basically the question here is that comparing the prevalence rates between two groups in the research question. First research question, nephropathy in controlled versus uncontrolled type 2 diabetes. And the sample size formula is given here. Don't worry about the formula. Just remember this formula, but I'll explain you what is the components of this formula. Now, n is nothing but sample size. The letter n is represented as a sample size. And, there is also a component called Z alpha by 2, the value is already given there, 1.96 for alpha 5%. Okay. For alpha 5%, if you see that formula Z alpha by 2, just use that 1.96. That's it. Don't worry about anything else. Okay. And Z beta is also another component here. Just use 0.84 as a value there for beta here. Okay. Don't worry about anything else. Only thing is you have to plug in the values in this particular formula in which these values are fixed. Z alpha by 2 is equal to 1.96 is fixed. Z beta is equal to 0.84 is fixed. Okay. Whereas other components here, like P1, P2, those are not fixed. Those are coming from literature basically. Okay. Remember that P1, P2, they are coming from literature. Whereas Z alpha by 2, Z beta, they are not from literature. They are fixed. You can blindly use these values and plug in your sample size. Now, what is P1 here? I chose P1 as 45%. Now, who told me to choose? It is not, something I put some value. I just, based on my experience in this industry and some of these literature I reviewed and things like that. So based on that, I put P1 is equal to 45%. That is nothing but prevalence of nephropathy in uncontrolled T2DM from some South Indian data. But you need not choose this. Again, I'm telling you, like, you have to refer the literature appropriately for this. Now, P2, prevalence of nephropathy in controlled T2DM, okay, from literature, which I put as 20%. Now, if you input all these values in the above formula, you will get around 57 per group, okay. And I also added a kind of, last line there, add 10% for a dropout, which is nothing but like, actually the context here is that, if you are running a clinical trial kind of settings, then you need to ensure for dropouts. Okay. That's where, like, you add that 10% component to 57, which will, like, which will give you a kind of 63 per group, and total will be 130 patients total in total. Okay. Now, N value, remember that N value, sample size per group. It is not total. Remember that sample size per group. So after I calculate the fourth step, you see a sample size of 57 per group. That is our N. Okay. Understand my point? N is nothing but sample size for a group. Z alpha by 2 is always fixed for you. Don't worry too much. And we need to worry about as a statistician, but you don't worry about that. Okay. Z alpha is fixed 1.96 and Z beta is fixed 0.84. All you need to do is that get some values for P1 and P2 from literature. Once you get those values, or literature, or I'm not saying that you need to refer literature, talk to your guide and get some values there and input those values in your formula. You will get 57 per group. Now, this is the scientific way of establishing sample size. Okay. Now, for your case, again, I'm saying that, be scientific as much as you can. I'm not saying that you need to follow this way, but you follow a way which is like more scientific after talking to your guide. Okay. So now what I will do is that, there is another kind of, exercise. The previous example was for prevalence rate. This example is for the next research question. Research question, research question 2 as well as research question 4 also, because they are more or less same in terms of their properties of experiment. Comparing measurements between two groups and pain duration after anesthesia, and that's the kind of question there. So here the sample size is little bit different because you are measuring the the outcome here is that duration of post-operative analgesia in terms of hours. The previous, what is previous outcome measure? Previous outcome measure was prevalence rate. Now, prevalence rate is always expressed in terms of percentages or proportion, whereas the outcome in this research question 2 and 4 are kind of the number system there. I'll tell you more about this in the next session in basic biostatistics. The type of variable we are using. The type of variable in the previous research question 1 is prevalence rate, which is in terms of percentage or proportion. But in this case, it is a number, duration of post-operative analgesia. So the sample size differs here. Okay. Sorry, the sample size formula differs here. Okay. For this kind of exercise, the sample size formula is given here. Again, you see Z alpha by 2 plus Z beta, which is, as I said, always fixed. Okay. Now, there is one more component here called sigma square, which is a standard deviation. You need to get it from literature. Okay. And I also have one more component here called delta, which is a minimal clinically important difference. I told you, like between the two groups. What is that clinically important difference you want to see? Okay. Now z alpha by 2, again it's fixed. Z beta is fixed, which you have seen in the previous example. Only thing you need to get a value is sigma square and delta square, or sorry, sigma and delta. Okay. So that you will get it from the literature or after speaking to your guide. Okay. So now I have given these numbers here. I just put some numbers here based on my experience. And finally, and the fourth step, you see the final sample size is 35 per group. Okay. So 35 per group is required to run your this research question 2 experiment. Okay, that's how I see. That's how you see this as a kind of scientific way of calculating the sample size. So overall, this this in a previous sample size formula and this sample size formula, overall, all you need to do is that the first sample size formula, all you need to do is that get P1 and P2. Other things are fixed. Z alpha by 2 is fixed, which is nothing but 1.96. Z beta is fixed, which is nothing but 0.84. Now, the next experiment where, duration of post-operative analgesia, Z alpha by 2 is fixed, which we have seen. Z beta is fixed. And only thing you need to get the information from outside is sigma and delta. Okay. If you have this information, you can work out the sample size very well if you are running a proper clinical trial here. Okay. And then so basically what I want to do is now is that I'm closing this session for now, but I don't know, ma'am, do we have any time for questions
Yeah.
before we regroup? I mean, basically before we before you start working on this. So basically what I want, I'll tell you now what I
You
want is
can
that
give them. You can give them some exercise. We will see if time process. We can have session tomorrow also. We can extend it. No problem.
yeah.
You
So
go
I
ahead
don't
with
know.
one example, working example.
Yeah, working example. So what I will do is that, I don't know whether you have access to this slide, probably not. I will paste this information in a chat. So all you need to do is that, really need to work on this, yourself. You need to ensure that you get this 57 per group. Okay. Similarly, in the next thing, you need to get this number 35. So I hope this is okay, and you can just work in the backdrop. So I'll paste this thing now in your chat window probably. How do I do that? And maybe I can just
I think 1, 2, 3 you will give, right?
yeah, 1, 2, 3 I'll give, yes.
Right. They will solve and the formula.
And the form I'll give everything actually. So what I'll do
Okay.
is that what I will do is maybe I can put it in chat, right?
Yes. Yes.
Okay.
Are you giving the solved one, Shashidhar?
Yeah, I'm giving the solved one. Or are there any groups, ma'am, or no?
No, let them do individually. We can ask one of them to
Okay, then
share.
we will do one. Okay, then okay, that's fine. So I'll just copy it, and then where is chat here? Okay. No, it's not pasting. I don't know.
It's not pasting. I would suggest one more, Shashidhar. What we'll do is, try to do that. Otherwise, we'll give them home assignment.
Yeah, that also we can do. Yes, that also we can do. I think that is better. I think.
Just see if you can paste it.
Yeah, I'll do one thing here.
Try to do that. Yeah, as sir does that, just one question for all of you. What is the study design we are implicating here? Prevalence, to estimate the prevalence of nephropathy in uncontrolled. Compare that with prevalence of nephropathy in controlled. Which study design are we using? Anybody would like to answer? Is it observational, interventional, or in observational, case control, cohort prospective? Which kind of study design is more preferable here, which is feasible? Anybody would like to answer? Yesterday we have done study designs. No? Would you like to collect the data in one go from the patient's records, talk to him, understand and collect the HbA1c and urine microalbuminuria? Do you want to do that, or you want to follow up with the patients? You want to see patients with uncontrolled diabetes and follow up to see development of nephropathy. Which is the study design you want to use? Anybody? As a postgraduate? Anybody? You should open up. Sir is going to give. Are you able to paste, Shashidhar? No, no.
No, I'm not able to. I think some
Okay,
maybe
okay.
because of not admin rights. I don't know that.
Okay, okay.
Uh,
Let me see. Yeah, anybody would like to answer that? Which is a study design would like to use? Study design. Is it a clinical trial? Is it an interventional study?
yeah, yeah. So that's
Or
something you
is
need
it an
to really
observational? Yeah,
think about it. Like
yeah. Yes. Open up.
what what is that you want to achieve, first of all,
Hmm.
like what is that, how do you want to approach, I'll tell you one thing, like this is something I'm telling you because nobody has told us to do this way, or nobody has told us when we were students, right? You have to be really strategic in your thinking. Okay, just use some strategic kind of thinking, just take a step back and think, and review your experimental questions. What can you do to achieve your objective? How do I approach this? And how do I frame my clinical question of interest? How do I frame my sample, how it look like, so that I get a appropriate results from. And so just think in a more strategic way, rather than something like you need to do something. you know Doing something anybody can do, but thinking strategically on this is something very important. And I'll tell you, like, it will help you when for those who are coming to industry, or for those who are like going to more professional things, you will definitely uh, you know uh, you'll feel you started thinking strategically about your things and things like that. So it will be helpful to you. So don't think from something from operational perspective, or something has to be done, I will do. Not that way. Rather than that, take a step back and think, like, how can I strategize myself in doing this particular experiment? So so that way you can think about design, what I need to do and things like that. So just a kind of piece of advice which I'm telling you, which I have nobody has told us when we were students. Yeah.
So I think you're not able to paste this as a.
No, I'm not able to. I don't know, like.
Okay, then let us frame 3 exercises and give it to them to solve it and come tomorrow.
Yeah. So, ma'am,
That is-
you have my slides, right? You can just
Yes, yes. Should I try? I don't think I can edit. Do
you
you?
no
From my.
like yeah, I had sent you
Yes,
previously
yes.
in the WhatsApp.
Yeah.
If you,
I
I don't
will.
know how.
Yeah, I will share that. Yeah.
Yeah, yeah. Okay, fine. Those
Okay.
4 slides only. Yeah.
Yeah.
So, any questions before we close?
Any questions? Open up. Are you all there? Otherwise, I'll have to pick up students.
So,
Yeah.
yeah.
Yes,
Sir, I have a
Dr.
question.
Sagarika. Yes, please.
Yes, good evening. Sir, like in a case control study or when we're comparing two groups, is it mandatory the number should be like 50-50 or nearby numbers?
No,
Like
see, the
100
thing,
sample? Yeah.
you see, basically, I tell you, there is a statistical kind of science behind that. We want to choose at a minimum of 30 subjects per arm. That is just because there are a lot of statistical concepts behind that, which I'm going to talk about in next session. Basically, it's nothing but normal distribution kind of setup. If you want to see a kind of normal kind of data, a kind of bell-shaped curve where everything is like normally distributed, your data is basically distributed normally. So in order to ensure that, we need to have 30 subjects at a minimum, okay, per group. If you have 30 subjects at a minimum per group, then obviously like there is a chance that you should be able to get the desired results. But doesn't mean that you always choose 30 just like that, just choose some register and just get 30. Not that way I'm saying. You have to really scientifically validate yourself, like how do I choose 30? Okay, somebody told me to choose 30, but how do I choose 30? From which component I have to choose, which is like the kind of factors I need to consider to choose 30. So that's very important. But yeah, to answer your question from statistical science perspective, 30 is something like most of the people say that if your per group and sample size is 30, that is a minimum required. So beyond that you can go up to like 50 or 60 also per group. It depends on the what type of experiment you want to do.
Can I add, Dr. Shashidhar?
Yeah, sure.
Yeah, so Dr. Jayashree and we, when we were in ethics committee, we were discussing this. So the acceptable one in many ethics committees which review postgraduate synopsis is that for clinical trials, if you do like dexmedetomidine, 30 would be acceptable in each group, or even sometimes the follow-up is for 15 days. He told very correctly, Shashidhar, Dr. Shashidhar told technically, I mean, we agree completely with that. But if it's a cross-sectional study, then you go as per the sample size that is given by the statistician, which you discuss with the statistician. Not very high. You should take a feasible study where the sample size may be 50 to 60 per group, which can be done over a period of 1 year. So there, cross-sectional studies where you are collecting data at one point of time, there they may not agree for a 30-30. They may want you to go to actual sample size because it is doable. Whereas for clinical trial, ethically I'm saying, feasibility wise, but definitely technically what Dr. Shashidhar said was correct. We cannot just say that 30 is enough. If you, I mean, you have to work out the sample size and then see if it goes 100 to 100, then say minimal 30 to 40 I will do because it is feasible. Otherwise, the ethics committees for a cross-sectional studies will insist that you adhere to the sample size which is decided given by the statistician after your discussion with them. I hope I am clear.
Ma'am, like in case control study, suppose two groups we are comparing. So the number in the sample size, the number should be equal or nearby numbers. So
case control studies, the sample size, I think Dr. Shashidhar will tell. Case control retrospective, right? You are getting the, there, I think it should be equal, no? Case control studies. It depends on the objective and the project. He will tell. He is a better person to tell.
Yeah, correct. So, like, ideally we expect equal number of subjects, but sometimes it so happens. I mean, especially I don't know about case control and, all these things, but in random clinical trial, what happens is that sometimes there are some scientific reasons to prove that the test arm, the test treatment is more, effective compared to your reference arm. Like imagine two groups, test versus reference. Okay. There are scientific evidence to prove that your test arm is really effective. In that moment, the doctors, I mean, again, I'm coming to doctors here because, when we work in the real-time environment, so most of the things we get input from doctors or the physicians. Okay. They will say that we have evidence to prove that this compound, this molecule, the test molecule is really effective. So can you choose more number of subjects on the test arm compared to reference arm? So that's where, like, sometimes we differ. Like, in the test arm, we may have like 40 subjects, but in the reference arm, we may have 20 subjects. So that's how the kind of, caveats for the equal number of patients. But again, having said that, like, sometimes, those example I told you, they are only for like, regulatory submission purposes. Because they definitely we want to prove that that test treatment is effective. But in your case, your experiments are mostly a kind of exploratory in nature. They are not confirmatory in nature. So exploratory, we have some flexibility, like to choose the sample size, mostly based on feasibility, but put some scientific aspect also into that.
Correct. Jayashree, would you like to add something?
If I may add.
Please.
The Apurva, I understand that you are planning to do a case control study and you want to limit your controls. Generally in epidemiology, what we say is we need to have at least equal number of controls, or sometimes, in fact, even more controls. Sometimes we take double the cases as controls. It is only to, as sir was saying, because you are giving additional criteria. You have formed a hypothesis in your descriptive cross-sectional studies. You are trying to, in analytical studies, you are trying to kind of prove that or confirm that. So in that case, we need to have equal number of controls. So many a times, even in ethics committee, they come up with these things, but we usually advise them, they must have equal number of controls, or else there will be distortion in terms of results. Dr. Praveen, if you may add, if you
Yes,
want to
yes,
add,
yes,
yeah.
yes. I fully agree with you, ma'am. Am I audible?
Yeah,
Yes,
yeah,
yes.
very much. Yeah.
Yeah. So people quote multiple reasons that, I want to take 30 cases and 15 controls. People even say, I want to take less number of controls. When we ask them what is the reason, they say the kit is very costly, sir. And when the people are having a particular condition, if we want to use those kits only for the confirmation of that particular condition. And normal individuals, those who are considered as control, they are not having the disease, and we need not do it among them, so that the cost is going to be saved. So the rule of thumb, and it is a universally accepted and most desirable thing, is that you should have equal number of cases and controls. And as madam mentioned, you may have even double, triple, quadruple number of controls compared to the cases. For example, if the disease is very rare, you want to do something on multiple myeloma, so you may not get large number of multiple myeloma cases. At that point in time, having more number of controls will strengthen your hypothesis rather than taking equal number of controls. This number of controls is a limited. There are studies which have shown that you may take up to 4 times. The number of controls can be up to 4 times than the cases. If you go beyond 4 times, for example, if you take 5 times, 6 times, the evidence that comes out of those studies will be same as that of taking quadruple number of controls compared to cases. So the matter is, you need to take up to maximum 4 times the number of controls compared to the cases, but at no point in time the number of controls should be less than the number of cases. They should be at least equal. Yeah, there are sample size calculation formulas using the odds ratio for calculating the sample size for case control studies, which is the ultimate outcome of case control studies. You can use those formulas for calculating the sample size. I think if it is a pure case control study, do not rely on prevalence data for calculating the sample size. Try to calculate it using the odds ratio. Thank you.
Absolutely.
Thank you. Thank you, Praveen. Thank you, Jesh. So, Dr. Shashidhar, where are we now?
Yeah, so basically I'm kind of, wrapping up this with few
Yeah.
key takeaways. Basically, what we have learned so far. Let me slide mode. So there are 5 points, 5 key takeaways. The one is like sample not equal to population. Like, a well-chosen sample represent the population. Poor sampling is garbage in, garbage out kind of thing. Stratified random sampling, as I said, like, the kind of, concepts I was giving you are like mostly inclined towards randomized clinical trial. And we always use stratified random sampling in clinical trial settings. But having said that, you heard from, people like how you can, like, choose a sample size appropriately. That you can do, but put a lot of scientific things into that one framework. Sample size, absolutely, it's not a guesswork. There is a way to do that. There is a formula. There is something called alpha power or beta and things like that. Just for your purpose, don't too much worry about that. But just remember these things. It's not a guesswork, but it's a computational way of doing it. And then in actual clinical trial, we always had a dropout rate, but it may not be necessary in your case. So, but if you think about, or if you see a kind of random clinical trial is being done in front of you tomorrow, then you are in a position to talk about all these things. You can say that, have you added dropout rates, and have you done proper sample size calculation, have you done a guesswork, so that you can basically talk about during that time. And report your sampling method. Again, it's very important in your experiment also, like, please ensure that you put a language around, like, what way you have chosen the sample, what is that methodology, scientific methodology you have used, even in your observational studies also. So that has to be done. So these are the kind of 5 key takeaways, basically, laying a kind of foundation for you to think about your sample size in your experiments. But yeah, so be strategic in these cases, be strategic in thinking about sample size and things like that. So I hope this session was useful. I'm really thankful to you all, like, attending my session. And if you have any questions, you can ask me now or later also. Maybe I'm more than happy to answer your questions. So yeah, thank you so much.
Any questions from other than Dr. Sagarika has asked? Anybody else has any questions? You can post it in the chat box also if you have any questions.
Yeah.
Basically,
So if it is same chat box is, I mean, even tomorrow, if the same link is used, probably I see the questions, I guess. I don't know. I have to see.
Questions? No questions.
You can't use this. No, if at all people are posting questions, can I see it tomorrow? When I
I will ask them to send it across. We have a group, WhatsApp group. Okay. I'll forward it. Please go through. I will share the slides today. Go through that, and I have sent some reading material also. These 6 days, another 3-4 days to go. Please devote your time to study, because this is a new topic for you. You have not been exposed so much in depth during your undergraduate days, isn't it? Of course, little bit was covered in community medicine, but we wouldn't have gone so much in depth. So now that you have to apply for your synopsis, I would suggest go through that, and I have given that assignment. Tomorrow you should present that before we start the sessions, the research questions, and the study design. What is the objective? You need to write it and bring and submit. Tomorrow we are going to discuss that initially before we start the next session. So if there are no questions, thank you so much, Dr. Shashidhar. You have simplified as always, and definitely it was a good session.